Some experts are predicting another surge in COVID-19 cases here in the U.S. this fall. The CDC is tracking 3 new COVID strains spreading nationwide.
Joining us now with more on this is Dr. Stanley Perlman. He is a professor of microbiology and immunology at the University of Iowa. Thanks for joining us, Professor. So here we go. 3 new variants of COVID now make up nearly 1 in 5 new infections nationwide. What do we need to know?
Well, we know that these are versions of the variants that are circulating now. Right now, the most common variant is this BA5, which is not one of the 3 that you have listed. And these others are variations on BA5 and BA2, which was an earlier version. The virus is changing, we know, both to infect people better and also in response to the immune responses that so many humans now have against the virus. So we will see these changes. They so far haven't resulted in increased numbers of hospitalizations or deaths, but we know that these variants don't invariably have to become weaker, so we have to pay attention.
So the World Health Organization has said that they are struggling to identify and track new COVID variants as testing and surveillance is rolled back in many countries. So how is at-home testing impacting our ability to track these new variants?
Yes, so this is, I think, an important issue, because what's happening, people are testing at home, and if they're positive, most people will then follow the rules and stay home for a certain number of days and then wear a mask for a certain number more days, but they don't necessarily report it to a health authority. Certainly if the test is done by a state hygienic laboratory, then the testing would be more likely to be in the general population. But even there's not necessarily sequencing attached to the testing. So yes, as we become more, I don't like to use the word comfortable, but I will say comfortable with the pandemic, we're doing less testing and we're doing less sequencing. But even though our facilities for sequencing are very, very good now.
Well, it certainly seems like many people are letting down their guard. You were traveling recently, Vlad, and you were commenting on the number of people who are wearing masks. And I thought to myself, hardly anyone wears masks anywhere that I go. I couldn't even. Yeah. You had more people wearing masks than
when I was in South Korea just 2 or 3 weeks ago. Everybody is masked up, even when they're outdoors. Yeah. And then I was in the UK to cover the Queen's funeral, and very few people were wearing masks.
I still see
even indoors
signs up at certain our local stores that ask you to wear a mask, but no one's doing it. Not even the people working there, really. Yeah. So this, which brings me to this point. You know what the president said? I think it was last week or so. That the pandemic is over, and it seems like a lot of people are going with that. But
even though the White House walked it back,
White House did walk it back. But what's your take on this? Should we be more on guard this winter?
I think that we are not finished with the pandemic. Mm-hmm. So whether we have to be more on guard, if that's the right word, I'm not sure. But there's still we still have 400 deaths or so, or 350 deaths a day from this virus. And we think it's going to get worse over the winter, plus or minus new variants. The people who are dying, we think, are people who either haven't been vaccinated or people who have problems with their immune function, so they can't handle the virus very well. But this is a lot of people still dying, and this is still a major cause of death in the United States.
All right, Dr. Perlman, as always, thank you very much, sir. Great to have you.
Thank you.